welcome everyone to this Centre for Ageing and Dementia Research webinar on Food, Glorious Food. Delighted to welcome you here today. I'm Charles Muswhite, the co-director of the Centre for Ageing and Dementia Research, or CADA as we call it. We've got a great seminar ahead for you today. But first, just a little bit of background to who we are at the Centre for Ageing and Dementia Research. We're a research programme funded by Healthcare Research Wales, who fund a number of programmes on health and well-being in different aspects of all our lives. And we're the one who looks at how our health and well-being changes over our life course, particularly looking at later life from all different types of background and perspectives, from our biology, physiology, through to looking at things in terms of social aspects as we age, loneliness, isolation, looking at the environment as we age, so transport, housing, communities, and life, and we also look at arts and humanities elements as well. So we bring together everybody who's doing ageing research in Wales with the hope of making Wales the place to grow old in across the world, and be a leader in things, and get it really nice for us all as we age. We work with lots of people from policy and practice-based backgrounds, and one of the things we do to get our research out into the real world is have these seminars, and you know, because of COVID, we've been doing more and more of them online. And today we've got simultaneous translation from Larry. Larry, do you want to introduce how that will work just before we move to the seminar itself?
No problem. Diolch yn fawr iawn, Charles. There will be some Welsh contributions today. Those of you who understand Welsh don't need to do anything, but those of you who will require translation of the Welsh contributions will need to listen now. In a minute, a globe will appear, normally at the bottom of your screen, but if not, it's in the top right-hand corner under the 3 dots. You'll need to select that globe and then select English, and then done. So we'll have a quick test, and hopefully all of you will hear. And if you could put your thumbs up just to indicate that you can hear me, I'd be very grateful. Diolch yn fawr.
Diolch, Larry, that worked really well for me. And now I hand over to Catrin Hedd Jones, who's going to be hosting the webinar and taking it forward. So over to you, Catrin.
Diolch yn fawr iawn, Charles. Thank you. A mi fydd yng nghyfraniad i trwy'r iaith Gymraeg, felly gobeithio bod pawb yna chi yn gwrando ar lais lawr erbyn hyn. Mae'n bleser gyda i gyflwyno chydig o gyd-destun i chi'r cyfarfod heddiw. Darlithydd mewn astudiaethau dementia dwi'n Prifysgol Bangor, sef un o'r partneriaid yn y ganolfan Cader. Ac mae'r cyfarfod heddiw wedi cael ei ysbrydoli gan deulu arbennig iawn. Fe oedd mewn cysylltiad o fi yn dilyn i ni brintio cyfieithiad o lawlyrf ar heriau'r synhwyrau i bobl sy'n byw efo dementia trwy partneriaeth Merched y Wawr. Ac o'ch chi glywed mwy am hynny nes ymlaen efo Tegwen yn siarad. Roedd y teulu arbennig yma wedi profi dementia yn y teulu ac wedi dod i gysylltiad efo ni oherwydd eu profiadau personol nhw pan nath John Williams i fewn i gartre yn hwyrach yn y broses o fyw efo dementia oherwydd y cymhlethdodau oedden nhw'n byw ar y pryd. Ac maen nhw'n garedig iawn wedi rhannu fideo i mi o Fion, sef merch John, yn cyfweld Menna ei wraig. A mae'r fideo yn eitha pwerus ac yn eitha personol, ond dwi'n meddwl bod o'n bwysig i ni gael y cyd-destun oherwydd yn dilyn rhannu hanes nhw fel teulu. Dyma ni fel grŵp ymchwil yn dechrau hel yn syniadau at ei gilydd ac yn meddwl, wel, sut fellwn ni helpu i gefnogi bobl sydd yn gweithio ac yn byw mewn cartrefi gofal, oherwydd bod bwyd yn elfen mor bwysig yn ein bywydau bob dydd ac yn beth mor bersonol hefyd. Felly, dyma ni yn cyflwyno chi hanes y teulu Williams mewn fideo. Ac ar ôl hyn, fyddan ni'n mynd ymlaen i wrando ar Suzy yn sôn am Suzy Webster yn rhaid chydig mach mwy o gyd-destun o'i gwaith hi efo bobl sy'n gweithio mewn cartrefi gofal. A da ni'n croesawu'n yn gynnes iawn pawb sy'n dod yma heddiw ac yn gobeithio fyddwch chi yn teimlo'n hyderus i gyfrannu eich syniadau trwy'r chat, trwy'r blwch bach sy'n ar y gwylod y sgrin, lle mae deud chat neu Q&A. Felly, defnyddiwch y dechnoleg, mae croeso chi yr unegesion ar ôl chi wrando ar y fideo ac cael y cyflwyniadau fydd yn dilyn hefyd. Felly, if you don't mind, Kim, to play the video, please.
Helo mam. So dwi yma i holi chi am profiad o golli eich gŵr John Williams yn Hedd. Chydig dros flwyddyn yn ôl mewn cartra'n lleol ac oedd gyda fo vascular dementia. Dichrau fi am y profiad achos oeddech chi'n poeni lot am ffaith nad oedd o ddim yn bita a nad oeddech chi'n meddwl bod y bwyd yn addas.
Na, yn sicr yn y mis dwytha, mi oedd cyflwr John wedi dirywio a yn sicr doedd o'm angen gymaint o fwyd ac yn cael ei reid o'i flaen o. A fel esiampl, amser cinio, oedd o'n cael pryd 3 chwrs. Wel, allan am ond llwyad os wedi gymryd o'r cawl cyntaf, sa wedi cael digon. Wedyn cinio, cig, llisiad a lle. A oedd o'n medru torri'r cig i fyny, ac allan y llwyad sa wedi gymryd, mi oedd hwnnw'n mynd y was. Ac oedd un hefo dant melys, oedd y cwdyn yn dod, ond hyd yn oed eich llwyad, oedd o'n gymryd o hwnnw oedd o'i gyd mynd y was, a gwarth oedd o'n mynd wedyn.
A sut ydych chi'n meddwl fysa hynna i arbed y holl was felly? Ydych chi'n meddwl fysa fel di cael trafod hefo rhywun be oedd i oddynion o beth sydd wedi ddiwethaf enghraifft o sôn y bryd mawr cyniad y sul wrth allan a beth sy'n nhw wedi gallu cynnig rhywbeth gwahanol iddo fo mwyn i jyst cael ei fita rhywbeth?
Wel, yn heimlad i, efo'r cyflwr dementia, illa sa gofyn iddo fo be oedd eisiau fita. Illa doedd o'n mynd i rhaid atab o achos cyflwr i meddwl. Ond ar y llaw arall, mi ddylia bod y gofalwyr yn gwneud sylw a ddylia bod nhw'n gwneud nodiadau. Dydwch bod chi'n cadw nodiadau am wythnos dyfa sylw, wel dydy John ni'n mynd i bita trwy'r wythnos. So mae hynna'n dangos i ni, diolch yn hanner gymaint o fwyd, beth sy'n cael ei reid o'i flaen o.
Ond oeddech chi wedi sôn amdano y ffaith nad oedd o'r rhaid yn bita llawer o gig, ac eto mi oedd y gig yma, oedd neb wedi cymryd sylw o hynny'n dweud?
Wel, na gwaith dwi'n meddwl. Wch chi, meddyliwch chi am y peth, chances ydy dod o gegin, ni'n gallach na gyndo gynnyn nhw, syniad, gos o gynnyn nhw'r holl bobl oedd yn y cartra. A weddwch chi, am nad o gyn John ni'n cyflwr meddygol, fel dydwch chi clefi siwgr yn mynd felly, oedd o'n ddyn iach fel arall. Mae'n bod i feddwl oedd i mynd, a wedyn mewn ffordd oedd o'n cael cinio, a thasa person hollol, ond oedd o'n ei angen o. Cos hyd yn oed cyn o'n fynd i'r ysbyty fel oedd o'n ddyn yn tynnu am i 80 oed, ac oedd ni'n sylwi, o'n bita llawer iawn llai hyd yn oed adra.
A sut ydych chi'n meddwl, be fysa o ran system, sut fysa chi meddwl fysa'n weithio'n gwell o ran y cysylltiad rhwng y staff yn y gegin a'r gofalwyr? Ydych chi'n meddwl bod angen mwy o gyfathrebu rhwng y ddau grŵp?
O, dylia'n sicr. Mi ddylia bod y gegin yn cael gwybodaeth o pob uned. Sut oedd y bwyd wedyn yn fel, cos sydd o'n nhw'n sylwi faint o wast oedd o'n dod yn ôl. A mi gath o'i ddeud pan o'n i yno gyda nhw, bod yna wast dychrynllyd yno. Wel, wrth gwrs mae hynna'n gollad ariannol hefyd. Fysa nhw yn gweithio'r peth allan yn well. Mi fysa nhw'n elwan ariannol hefyd bysa'n. Ella fysa mynd at rhywbeth oedd yn fwy o help i'r bobl oedd yn sal.
So ydych chi'n meddwl bod gwell cynllunio a paratoi ac eich goruchwylio natur patrymau bita ar unigolyn ar y cychwyn yn help wedyn i dderbwyllio y gegin o be fysa gyfynion y person yna, a hefyd bod y gegin yn gallu cael mwy o gyfraniad yn beth sydd nhw'n gallu gynnig.
O, yn sicr. A wedyn mewn ffordd ella fysa gynno yr gegin fwy o ddewis wedyn. Fysa nhw'n dweud, a ia, di'r person yma ddim yn bita am llawer. Rwy'n ni fwyd bach ysgafn iddyn nhw heddiw yma. Dyn nhw'n angen y cinio llawn yma. Petha fel la, yn sicr fysa'n helpu. Mwy o gyfathrebu rhwng y gofalwyr a'r gegin. Fel bod y wybodaeth gen y gegin yn gyfer y darpariaeth.
A dych chi hefyd wedi bod yn helpu mewn cartra neu mewn canolfan yn y pentra cyn i chi golli'ch gŵr a cyn y Covid, yn helpu pobl efo rhoi bwyd i bobl hŷn, do?
A pobl oedd yn hollol iawn yn ei meddwl, ac oedd y bobl heini wedi siarad dros ein hunan. A oedden ni'n sylwi, bysa chi'n dychryn rhan fwyaf ohonyn nhw'n dweud, peidiwch ar ei gormod i mi, mae'n chydig bach dwi eisiau. So, mae yna wers i ddysgu, tydi pobl yma yn mynd yn hyn, eisiau gymaint o fwyd.
Oeddech chi'n teimlo yn rhwystredig bod na ddim digon o siarad efo chi ac efo ni fel teulu o ran? Achos tuag at y diwrnodia ola, doedd dat ddim wedi bita ddim byd, oedd na ddim lot o... Oeddech chi'n teimlo bod na ddigon o help o ran trio cael rhywbeth i fita, neu?
Wel, na, mond pan oedd rhywun, wyddech chi yn anffodus i John, o'n i'n teimlo hefo'r cartra fysa nhw wedi licio fysa ni fynd yna bob dydd. Ond yn anffodus yn ynghyflwr i, fedrwn ni ddim mynd, o'n i'n mynd yn swael fy hun ar y pryd. A wedyn, dydwch chi wedi'r gwaith yr wythnos o'n i'n medru mynd. Ac gyda cynnig o'n i'n ei helpu efo. Ond, wyddech chi pan oedd o'n o ben ei hun, dwi'n meddwl bod yn cael ei adael a ben ei hun llawer iawn. Ond am ddigon o ofalwyr, cos ydych chi'n meddwl am un person ar gyfer 8 o bobl. Wel, fedra fy hun efo ein bod yn bob man ar yr un pryd, i helpu bawb.
Felly, lle fysa chi licio'r arian fynd o ran ymchwil ar gyfer gwell paratoi a gwell strwythur o ran y cyfathrebu rhwng gofalwyr a pobl yn y gegin, a bod nhw'n gallu bod yn fwy hyblyg, fel ydych chi'n dweud, ie?
Ia, a gwell dealltwriaeth wedi gofynion y bobl bach efo dementia. Dim gofyn i'r bobl dementia eu hunan. Ac os neu gofyn i'r teulu be maen nhw'n hoffi a be maen nhw ddim, dyna swn i'n dweud yn bersonol.
Wel, swn i'n hoffi diolch i teulu Williams am recordio hynna a rhannu profiadau personol nhw. Yn naturiol mae profiadau pawb yn mynd i amrywio a da ni'n falch ofnadwy bod gyda ni bersbectif o gartrefi gofal llawer iawn ohonyn nhw trwy Suzy sydd yn gweithio yn ddiflino ers blynyddoedd i gefnogi bobl sy'n gweithio fewn y sector yma. Ond fel oedd Fiona a Mena'n sôn, maen nhw fel teulu wedi cyfrannu cof am John. Cyfraniad fysa nhw'n hoffi cefnogi yr addysg a'r hyfforddiant o fewn yr staff i helpu ni i rannu ymarfer da ac i wella'r profiad bydd pawb. Felly gobeithio bod heddiw yn ysgogi ni i ddod at yn gilydd yn bach mwy a bod ni'n gallu rhannu'r y gwaith da sydd yn digwydd hefyd. Felly gyda'r chydig gyflwyniad yna ac edrych ymlaen i wrando'r cyfraniadau chithau hefyd, swn i'n cael pasio drosodd i Suzy sydd yn mynd i rannu chydig o'i phrofiadau hi ac lle mewn cydweithrediad hefo staff mewn cegin fyd. Diolch yn fawr iawn.
Hi, hello everyone. I'm Suzy Webster. I'm the Care Home Network Manager at Age Cymru, and it was a privilege to be asked to be here this afternoon to share some of the incredible work that's been happening across the care homes, particularly over the last probably something like 16 months now. Where I sit at Age Cymru, I have the privilege of networking and chatting to many different people in many different care homes across Wales, and I now am working on a project called Tell Me More, which involves us doing Zoom chats with care home residents, which has been an absolute privilege and hilarious and sad and difficult at times, but just being able to talk with care home residents has been really helpful. And when we've asked the question about how things have been living in a care home over the last year and a bit, all the residents like to tell us about the food. They like to tell us about the food, and I don't know about you, but I certainly think for me it's been food that's kept me going a lot of the times. There's probably some work to do to work off some of that food at some point, but you know, sometimes the way we look for pleasure is through what we eat, and the care home sector has worked very hard, despite everything that they've been through in those last few months, to make sure that the residents are well supported, have choice, and that food is part of a day that can be enjoyable, believing that the choice of moving into a care home can be a positive choice for many older people. And a lot of the residents that we have spoke to have told us that they're very grateful to have been in a care home over the last year, because otherwise they probably would have been at home on their own with nobody. So although there's always much to learn, especially through the experience of families like Mrs. Williams's family, we must listen. We must listen to the people that are loving someone in a care home. We also must listen to the experiences of the care homes and the care home staffs and the cooks who are working so hard out there. By sharing this good practice and even signature dishes, perhaps, we can begin to appreciate the sector more for what they are doing well, and work together just to get it a little bit better if we can. So I have a very lovely care home chef with us this afternoon. She's wearing a mask, and inside her mask she's probably swearing at me right now because I have asked her to do this webinar with us this afternoon. But you know, Denise is out there, they're working every day really hard in a wonderful care home in Pembrokeshire, and who am I to stand here and, or sit here even, and talk to you about the work of care homes when I'm just sat in a little room in Chepstow. Denise is out there doing the job, so I'm so grateful to her. I'm definitely gonna have to buy her a gin and tonic when I see her next. I just wanted to ask Denise just a few questions about your life as a care home cook, and please relax, nobody can see you. And it'll be over before you even know it. So hi Denise, lovely to have you.
Hi everybody.
Could you tell me, or tell us a little bit about yourself? What brought you to care work initially, and then what brought you into the role of a care home cook?
Well, firstly, I think my mum brought me to care work initially, because as a child, I always remember my mum looking after all the old relatives that were poorly or dying. And they always used to come to our house, and mum would look after them. And unfortunately, they would pass away. But I loved it. We used to have great fun with them. Yeah, and okay, it was a very downside when they did pass away, but it was just something, I think, that because my mum did it, I sort of enjoyed looking after them with her. And it sort of started from there. I did go to work in a supermarket when I left school, absolutely hated it. But I was only 17, so I had to wait until I was 18 and then applied for a job on home care. So I started off doing home care. And I stayed on home care until I was 25 and had my first child. And then because I wanted to go back to work, I went to work in a care home, a local care home in Narberth. And that's where it started. I just went from there and eventually came to Pencoed.
So you worked as a care worker before becoming a cook.
Yes.
What took you into the kitchen? What was it about that work?
I think I had been a very long time in care. I sort of, it was from the time I was 18 until I was well into my 40s. And I think I just felt that I wanted to change. but I didn't want to get out of care. I wanted to stay in care, but I wanted to change in my role because I was getting older, basically. And I was very fortunate that I was working at Pencoed at the time. They were looking for a cook, offered me the position because I said if I didn't, I was thinking of leaving, and they said, well, why don't you try and do the cook's job, give it a go, see if you enjoy it, which I did. They put me through my NVQ, and hey, here I am, still here after 20 odd years. But I became a cook in 2006.
Okay. So what are the best bits about your job?
The residents. Coming in the morning with a smile on my face, just seeing them and trying to get them to smile back. That's just a great feeling.
Lovely, lovely. And obviously the last year and a bit, Denise, been very challenging.
Oh, very, yeah, it has. Firstly, I think what I found was trying to source our food, because we shopped with Tesco's online. Tesco's online were not very helpful, unfortunately. We were limited to how many items we could have, which you can imagine. We were having like 300 odd items a week, and they said we could have something like 90. So we had to then go out and source our foods from other companies, which we've done now. We still do use Tesco's, but obviously not anywhere near as much as we did. Yeah, so it's in one way it's been a good thing, because we are using more local, smaller companies which need our help now as well. That was quite challenging really in the beginning. Once we got over that hurdle, we were away to go, and we were doing cruises, and we've done Italian days, we've done old-fashioned teas, afternoons. What else have we done, Shani? We've done Spanish, we've done a Spanish evening. Yeah, we've done lots of things really. The old-fashioned tea was great fun, with the old corned beef and tongue, and giving them all the old-fashioned stuff that we could find. Yeah, that was really good, and showing them the tins and then sort of saying, oh, it didn't look like that in my day, kind of thing. Some of the things they didn't recognise now, but yeah, they really did enjoy. They enjoyed that.
So you've obviously used your expertise to sort of widen the way that you present food and make it more of an occasion rather than...
Yes, yeah, not just sitting at the table. We always do a theme. If we have a theme day, we always make it a theme, and we go out and we buy everything that we possibly can to go with that theme, so that they really feel as if they are actually there. I mean, the cruise ship was amazing. That was one of the best activity, well, the best activity I've ever been involved in. It was absolutely amazing. They had an a la carte 3-course meal. They went into a casino. We had a deck where they had their ice creams, and then we had them in the ballroom where they had their cocktails, and then we had them in the dining room where they had their 3-course supper. So yeah, it was really, that was a fab day.
We did the Iron Man as well. We cut
yes, we done Iron Man as well in the garden outside, and we had little water pools, and we cut up fruit for them, and bananas and things like that, and sandwiches, and yeah, they really enjoyed that.
Lovely, great.
Yeah.
So what are your 3 top tips for any aspiring care home cooks out there?
Well, one would be get to know your residents. That's the first, I think, most important thing, is get to know your residents. Then I'd say find out from the families what their likes and dislikes are, but they do change. They can come in and people can say, oh, my mother doesn't like coffee, or my mother doesn't like custard. But after a little while, once mum's been with us, somebody might give her custard by mistake, and oh, she's loved that. So they do actually change. Don't think because they're coming in, that's what they like or that's what they dislike. Just give them it to try now and again, because they might just decide, no, I actually want that. So that's another important thing. Thirdly, I think, is always get them to the table as much as you can, sit them comfortably, make sure that they can access their food easily, put it on a bright plate if you need to, give them knives and forks that got the special handles on if that's what they need. To me, those are probably the 3 top things I would say.
Lovely. So sort of in response to Mrs. Williams's video there, Denise, you're talking about teamwork between you all.
Absolutely, yeah, absolutely.
Across the care home, so it's not just your job to do one thing, and the carers all doing it together.
Yeah.
Yeah, keeping that communication going with the families as well, which I know has been very difficult.
Yes, yeah, it has.
For you all.
Yeah. We're getting there. We're getting there.
You are. We are.
Yeah.
Yeah. Thank you ever so much for your time. I
do. My pleasure. Thank you for asking me. Glad to be of some help.
But yeah, that's fantastic. Thank you.
Oh, thank you, Suzy.
If anybody's got any questions for Denise, please do pop them in the chat box, and we'll come to the questions at the end anyway. But I'm going to hand over now to Adriana from Cardiff and the Vale, who's got a presentation for you.
Hello everyone, good afternoon, Prynhawn da. My name's Adriana. I'm the team lead dietitian in the Cardiff Community Resource Team. So today I'm just going to talk a little bit about the Cardiff Community Resource Team, or CRT as we call it, and then just a bit about how we link in with care homes and some future developments. Sorry, I'm just having a bit difficulty of moving on the slides. There we are. Always a technical problem. So what is the CRT? So we are two teams covering Cardiff and the Vale. So we've got one team, which is Cardiff Community Resource Team, and we're split into two localities. So we've got the Northwest locality and the Southeast locality. Our other team is based in the Vale and is known as the Vale Community Resource Service, and they are based in Barry Hospital. It's a form of integrated working, so it's joint health and social care teams, and we also have voluntary sector input. The Vale did formerly have the Red Cross, but now they've got Age Connect, so Age Connect support both Cardiff and the Vale teams. So CRT, so we're a big multidisciplinary team, as I've said, so it includes input from consultants. We have nurses within the team. However, most of them have been redeployed to do the vaccine and testing at the moment. We've got physiotherapists, we've got occupational therapists, we've got speech and language therapists, dietitians, and we also, like I said, we're an integrated team, and we work with Cardiff Council and the home care managers and coordinators within the council, and also Ravenwood trained carers, part of the council, and we also have support staff, so we have rehabilitation assistants and admin staff, and also, like I mentioned, third sector support from Age Connects then. So what is CRT? So CRT, we support patients coming out of hospital, so discharge support. So patients being discharged from hospital, we support those following their hospital treatment within their own home. We also provide community support, so supporting patients to stay well in their own environment in the community. So we provide treatment within their own environment. So it could be therapy and care needs, or just therapy needs, and the aim to prevent hospital admissions where possible. So within the CRT and dietetics, predominantly our referrals come from community support and care homes. And the reason for referral, the majority is due to mostly undernutrition. I just want to talk a little bit about the care home integrated support team. There's a lovely picture of us there as well, as you can see. So the care home integrated support team, basically within CRT, we have some projects that we're involved with, and this is one of the projects. So it was really looking at an MDT approach to training. So whereas speech and language therapists and dietetics, we go into care homes quite a lot to support with training, as well as doing our dietetic interventions. We well, go back to the care home integrated support team. So with the MDT, I think what the other therapists within the team were finding, like physios and OTs, they were getting, over the past couple of years, getting increased referrals as well from the care home. So wanted to get a team together really to try and support the training from an MDT perspective. So our mission statement was to give all care home residents in Cardiff access to MDT support to enable them to stay well in their chosen environment, and to empower staff to identify those at risk and manage residents' health and well-being. So we work jointly with the Welsh Ambulance Service Trust. So we've done a lot of partnership working with them, because what they were finding was they're having quite a high number of calls from some of the care homes in Cardiff. So we kind of got together with them, who also provided some training for the care homes. And the physios would do training, they do walking aid clinics, OTs would do some training on posture and seating and things. So we'd all go in and do a bits of training. It's currently on hold at the moment, because of the pandemic. Another part of it was also, again, before things sort of kicked off with the pandemic, we were engaging with the GPs, and we started sort of an MDM, multidisciplinary meeting in one of the care homes, just to kind of get all together, have a holistic approach to managing patients, managing residents in the care homes. So like I said, it's currently on hold, but we are hoping to pick it up soon then. Okay, so the role of the dietitian then. So to assist with recovery and rehabilitation by working as part of the MDT to meet an individual's treatment goal, ensuring it's person-centered, provide dietetic intervention to individuals at risk of malnutrition and those requiring therapeutic diets, refer to specialist dietetic services where required. So in Cardiff, we have quite a big dietetic community team. And for instance, one of our teams is the chronic conditions management teams. And so they can provide specialist support for patients who need weight management advice, and for those for people living with diabetes. So also then the role then to educate and support care homes with regular nutritional screening using a MUST, malnutrition universal screening tool, and to identify residents at risk of malnutrition, and also to deliver education and training around healthy eating and managing malnutrition and dehydration. So it includes implementing good food first approaches, where we can use regular food and drink then just to optimize nutritional intake. The food and nutrition guidance for older people in care homes, that came out at the end of 2019, which is best practice guidance on how to provide quality, nutritious food to support residents with eating and drinking well within the care home setting. So we really want to support the care homes with implementing that then as well. Okay, so I just wanted to talk a bit about what we were doing now currently. So current provision is we're doing some in-house training with the care homes currently, which includes the MUST training, and so within dietetic CRT, we put together a guidance for identifying and managing that malnutrition. So once residents have been screened, then we've got a document in place with guidelines to, as a bit of guidance really what to do when if they're scoring 1, 2, just tailored to around care homes and good food first principles then as well. And then obviously then the training does talk about good food first as well. So currently our training was on hold for about a year with the pandemic, and we're trying to support virtually as much as possible. We made some adaptations now to the training, so we are delivering it virtually. We've also done sort of risk assessments with the venues. Now we can go back into care homes, following guidance and PPE. We can, with some of the care homes, they have quite some of the rooms are quite spacious, where we can provide still some face-to-face training and allow for social distancing within that as well. So that's what currently we're providing at the moment. So future developments. So yeah, it's very exciting really, because we've just appointed to a new post within Cardiff and Vale, so which is the dietetic and speech and language therapy assistant practitioner. It's a new role, and we appointed two people, and they will be based predominantly in the care homes around Cardiff. So I think this is really going to be exciting for future partnership working, and they'll be able to provide some refresher training as they go. They'll be able to identify any training needs within the care home, and we can support them. We can support the care homes then as best as we can. So I think it'll be a really good, something really exciting that we can develop. So we've more scoping about the role, so we haven't completed the competencies yet, so we're still in the process of doing that, but I can see it being a really positive thing. And then we also have got the development of the Gold Standard Snack Award. So we'll be working jointly with our public health dietitians, as well as the care homes and other partners. So I'm not going to go too much into this, because this is where I hand over to my colleague, Marie Price. So she's going to talk a little bit more about that. But thank you for listening. And I think I've got a slide with some of my contact details. I don't know whether it's gone over. Not too sure, but I'll hand over to Marie Price to tell you a bit more about the Snack Award.
Hello, my name is Marie Price. I'm one of the public health dietitians, and I work with Adriana, as she just mentioned, in Cardiff and Vale University Health Board. So I'm just going to talk to you all briefly about the Gold Standard Care Home Snack Award. So just a small bit of background then as to why we're implementing this is so that we know all the evidence about how important good nutrition is as we get older. It reduces the risk of malnutrition and also helps improve our health. So I think with those things always on our minds, we wanted to implement an intervention that would complement the good practices that are already out there, that are already being delivered in the care homes. And we also wanted to help towards ensuring the good nutritious snacks and drinks for residents. So we wanted to particularly also have a focus on modified consistency snacks and drinks, because we know sometimes that they can be quite limited. It's quite difficult to think of a range of choices for the various different consistencies of those foods to match people's diets. We also have other awards. So for example, we have a Early Years Gold Standard Healthy Snack Award, which is to a very different audience. However, so it's completely different to adults in care homes, but it is across Wales and it works extremely well, ensuring a number of good practices. So we felt that if it works for the early years, can't we just adapt this and use it with older adults in care homes? So as you're aware, and like Adriana just said, the Food and Nutrition in Care Homes for Older People guidance from Welsh Government came out in 2019. So it was a perfect opportunity for us to look at this piece of work and try to align them together. Unfortunately, the pandemic happened, so it pushed our plans back a little bit, but we're getting back on track now at the moment. So we were hoping as well that by aligning these two together, it will showcase, like we said, what the care homes might already be doing as well in their practices. So the main aims of the award are for the provision of healthy and nutritious snacks and drinks, is to ensure that positive eating environment, good food hygiene and safety, and promoting a whole setting approach to healthy eating, including foods provided during celebrations and regular activities. So a bit like the ideas that Denise was saying, the different themes and how you incorporate those good snacks and drinks through fun events. So how the award will work on the ground. So we're going to be piloting it first in Cardiff and Vale, so across some care homes in both of those areas. As Adriana said, it's joint work with public health dietitians, community resource dietitians, and our speech and language therapists. We're also collaborating wider with other partners. So for example, nurse assessors, training and development leads, food hygiene, and a range of different people. There will be a set criteria that the care homes will be assessed on, and then how that works is a member of the team goes out to discuss the award with the home, and then following that, the assessment. Upon achievement of the award, that will actually last for 2 years. So then every 2 years there would be a re-accreditation to keep the award going. And like I said earlier, it'll all be aligned to the Welsh Government best practice nutrition guidelines. So it's almost showing, you know, how you're achieving those guidance. Just a little bit more about the snack menu. I'm not going to go into too much detail, but we've covered a range of different categories to try to allow for the different dietary needs. So the menu will have a healthy options section, just for those that are following just a general healthy eating diet. There'll also be a section for nourishing options, so for people who perhaps might need higher protein or energy requirements, or might have a poor appetite. There's also easy to chew, and there's a whole modified consistency section, which takes you through all the different consistencies and gives you a whole range of different options. So finally, it's over to you guys a little bit. I've got a few questions here that I was hoping people wouldn't mind answering. So you could either just speak out, or you can put your answers in the chat. I am going to provide you with my email details and my telephone number, so if you wanted to talk to me outside of this, you could. But my questions to you are, what do you like about the idea of this snack award? Is there anything you think we're missing? What do you think the challenges would be if you were to implement this in your care home? And what do you think you're already doing that would demonstrate best practice? So if you don't mind just taking a minute or two just to think about these questions, please feel free, like I said, to either speak out now or answer them in the chat, because any feedback we would be very grateful for, so that we can use that in our rollout of our pilot. So I'll just check the chat for a moment. Right, so there isn't any answers just yet. Yeah, so just really, like I said, just to summarise, I guess, what we're trying to do is to work alongside care homes, promoting the best practice that's already going on, try to make sure that there's as much variety as possible, covering a range of all the different consistencies and the different categories. Like I said, is looking at other things as well, so the eating environment are all the things that people are already doing, but you know, a resident sat out in the dining room if they so wish, and it's again running those good food options through celebratory events that you're already delivering. Whilst I leave these questions on the screen for a moment, is there any other questions anybody has about what Adriana or I have covered? Because we could also use this time to talk about those now. No, okay, what I'll do is I will pop my details up here. I'm just trying, bear with me. And I will hand over to our next speaker. But like I said, please feel free to contact me or Adriana if you do have any comments or questions about this. Oh, thank you.
Helo, pnawn da I chi gyd. Tegwen dwi a dwi'n gweithio I elusen Merched y Wawr, a dwi wedi yn lleoli yn Aberystwyth, ond Fel arfer, ni'n cynnal rhyw 2,000 o ddigwyddiadau ar draws Cymru yn flynyddol. Ac ar ddechrau y cyfnod clo, y sylweddolwyd yn fuan iawn bod angen gwneud llawer iawn o newidiadau. Un o'r syniadau gafodd y staff oedd creu tudalennau gweplyfr, sef tudalennau Facebook newydd. A un o'r rhai wnaethon ni gychwyn gyda reit ar y cychwyn cyntaf oedd curo'r corona'n coginio, lle oedd yna blatfform i bobl rannu i syniadau, i dyheadau, gofynion am fwyd lleol, beth oedd ar gael, a wedyn defnyddio yr dudalen mewn ffordd i rhannu arfer da, i ofyn am ryseitiau, ac i gydweithio gyda'n gilydd. A mae'r ymateb wedi bod yn syfrdanol. Un o'r pethau cyntaf wnaethon ni, ar ôl gosod y dudalen, oedd sicrhau bod ni yn hyrwyddo yn reit eang. Ac erbyn hyn, mae 16,900 o ddilynwyr gyda ni, dros filiwn o argraffiadau, a wnaethon ni gyhoeddi llyfr ar ddiwedd y flwyddyn gyntaf, a mae dros 4,000 copi o'r llyfr wedi gwerthu hefyd. Beth oedd yn braf o wneud yn blatfform ar y we, oedd yn cyrraedd y byd cyfan, nid yn unig just Cymru, ond o'n i'n cael ymatebion o Australia, o Thailand ac yn y blaen. Felly mae fe wedi bod yn blatfform dwyieithog, mwyafrif ohono fe'n Gymraeg, ond nifer fawr yn ddysgwyr ac yn cyfrannu hefyd. Wnaethon ni gydweithio gyda gwasgarau gwalch o ran y cyhoeddi, ac hefyd wnaethon ni werthu nifer o nwyddau, fel llwy bren i ddefnyddio yn y gegin, gyda gwmni a adnoddau arbennig Llanidan. Ond, eto, roedd angen nawdd, fel elusen, i wneud bob prosiect fel mae'r rhan fwyaf ohonoch chi'n gwybod mae angen nawdd. A felly wnaethon ni gydweithio gyda Cywain, sydd ag arbenigedd bwydydd Cymreig ar draws Cymru, a Hybig Cu Cymru i gael nawdd tuag at yr prosiect. Beth oedd yn braf iawn oedd gweld yr ymatebion, ac un o'r ymatebion cyntaf, a mae fe wedi parhau war y teg, cartref preswyl Plas Gwylym sydd wedi leoli yn Pen y Groes Gwynedd, wedi bod yn rhannu i straeon gyda ni. Yn gweud fel mae'r trigolion wedi bod yn cynorthwyo i goginio, ac fe welwch chi y lluniau rhai ohonyn nhw ar y dde wrthi yn coginio ac yn helpu'r cogyddion. Dwi'n meddwl bod y lluniau yma'n gweud cyfrolau, rhoi cyfle i trigolion, i gael cyfle i ail fyw yr hyn o'n nhw'n arfer wneud yn y gorffennol, ac hefyd dwi'n gwybod bod Hafan y Wain yn Aberystwyth yn dda iawn am rannu y gweithgareddau yma yn gyhoeddus. Yn union fel mae Denise wedi sôn, cael diwrnodau themau, dathliadau arbennig, cofio'r ail ryfel byd ac yn y blaen, a defnyddio bwyd o'r cyfnod, mae fe mor bwysig. I ni hefyd wedi bod yn rhannu yr straeon trwy'n cylchgrawn, a fydde posibilrwydd cryf fydden ni'n tybied i'r gwasanaeth iechyd, ac hefyd i'r gwasanaeth gofal fod yn defnyddio unrhyw ddeunydd sydd gyda nhw'n barod i rhannu straeon o arfer da. I ni hefyd yn ystod y flwyddyn diwethaf wedi creu podlediadau, podcasts, a dwi'n teimlo bod rhain eto yn bell gyrhaeddol, yn rhoi cyfle i bobl ddangos yn weledol ac i glywed y stori. Felly, os oes gyda chi gogydd da fel Denise yn eich cartre gofal, gofynnwch iddi hi wneud yr arddangosfa coginio yn weledol, a siarad drosto fe, a wedyn rhannu fe ar y platfformau cyfryngau cymdeithasol i gyrraedd cynulleidfa eang iawn, ac i rannu eto arfer da. Ers dros hanner 100 mlynedd, i ni hefyd wedi bod yn recordio eitemau o'r cylchgrawn ar gyfer llyfrau llafar Cymru, Talking Books Wales. Ac dyma ffordd arall o gyrraedd pobl, falle sydd â'i golwg ddim cystal, ond sydd am glywed am hanesion bwyd ac am ddentro ati i goginio. Felly ffordd eto o gyrraedd cynulleidfa arall. Un o'r prosiectau fuon ni'n gweithio gyda Catrin oedd dementia a heriau i'r synhwyrau, ac wrth gwrs Can y Gan, y CD. Mae gyda ni gopïau o'r CD ar gael yn y swyddfa o hyd os oes rhywun am gael copïau, ac mae'r ymateb wedi bod yn arbennig o dda. Eto, un rôl fach oedd gyda Merched y Wawr, sef codi arian, yr cefnogaeth ariannol, y sponsorship. Felly, os oes yna brosiectau arbennig, mae yna sefydliadau fel yn rhai ni yn hapus i gydweithio i godi arian ar gyfer sicrhau bod pethau yn gweld golau dydd. I ni hefyd yn cydweithio'n agos iawn gyda pethau fel y papurau bro, gyda undebau amaethyddol, ac yn hoff iawn o weld pwysigrwydd bod rhywbeth yn cael ei gyhoeddi. Felly gyda'r llyfr Curo'r Corona'n coginio, nid yn unig o'n i'n hyrwyddo fe'n misg yn aelodau'n hunan, yn cymunedau'n hunan, o'n i'n rhoi gwybodaeth i'r papurau bro, i'r undebau amaethyddol, am bwysigrwydd safon bwyd, bod ni yn hyrwyddo bwydydd Cymreig, bwydydd o safon. Ac un o'r nosweithi poblogaidd ni wedi cynnal canoedd o nosweithi Zoom yn ystod y 19 mis diwetha, a digwyddiadau Zoom yn ystod y dydd. Ond un o'r ser eto oedd gofyn i gogyddion proffesiynol a fydden nhw'n hapus i gynnal sesiwn goginio. Eto, oedd Hybu Cig Cymru yn fodlon hyrwyddo'r digwyddiad i ni, yn fodlon noddi yn rhannol y digwyddiad, ac oedd yn codi cwestiynau ynglyn ag ansawdd y bwyd, sut o'n i'n paratoi'r bwyd, hylendid y bwyd. Felly, mae hwn yn ffordd dda iawn o gydweithio gyda cogyddion i hyrwyddo arfer da. Ac eto, os ych chi moyn mynd cam yn ôl, yn enwedig os oes rhai o'r cartrefi gofal, efo gerddi, neu gerddi cymunedol sy'n cydweithio gyda chi, cael nosweithi neu digwyddiadau Zoom neu digwyddiadau go iawn yn yr ardd. Adam yn yr ardd yn rhywun enwog yn Gymraeg sy'n cynnal nosweithi sy'n sôn am bwysigrwydd bwyd cynhenid. A un o'r prosiectau eraill wnaethon ni weithio arno oedd Curo'r Corona'n crefftio. Eto, fel oedd Denise yn sôn, gweithio ar brosiect arbennig, a mae blodau gobeith yn brosiect arall i ni wedi cydweithio arno, lle ni'n gofyn i bawb greu blodau i greu enfys fawr o obaith yn y diwedd. Ac eto, trwy'r crefftio, yn debyg iawn i'r coginio, i ni wedi llwyddo i gyrraedd pobl falle fydden ni eriod wedi cyrraedd o'r blaen, cael aelodau i greu mygydau, i greu dillad PPE, i greu bagiau. Felly, yr syniad yma o gydweithio ar brosiect, felly os mae prosiect bwyd yw e, treul meddwl yn eang iawn am yr ystod eang o sut mae cyrraedd pobl targed newydd o bobl. Ac wrth gwrs, mynd amdani, just cyn y cyfnod clo, fe wnaethon ni dorri record byd am greu y cagen gri fwyaf yn y byd, the biggest Welsh cake in the world. Felly, mae modd torri recordiadau byd trwy gydweithio gyda partneriaid. Cyhoeddusrwydd yn hynod o bwysig. Os oes gyda ni prosiect, Catrin Hedd yn wych am wneud hyn, o ran cydweithio gyda'r wasg, yn enwedig y wasg yng Nghymru. Maen nhw'n barod iawn i roi sylw ar raglenni fel Pnawn Da, heno, mae Radio Cymru, Radio Wales, i gyd yn barod iawn i rannu storion o'r math yma. Felly, os ych chi moyn lawnsio y cynllun y gold standard ac yn y blaen, fydden ni'n tybied am cydweithio gyda'r rhain i gyd i gael yr impact cymunedol bod pawb yn gofyn beth yw yr prosiect arbennig yma. Ac wythnos yma'n unig, dyma rhai o'r danteithion melys sydd wedi bod ar Curo'r Corona'n coginio. Os nag ych chi wedi bod ar y dudalen weblyfr, ewch arni i gael eich ysbrydoli. Ac os gyda chi unrhyw gwestiynau, mae'n ddiddorol iawn mae atebion yn dod yn syth. Ac un o'r bethau, dwi wedi darllen ar y dudalen, ond ffilus i ffindio'r llun i ddangos rhywun yn gweud, os ych chi'n neud pryd o fwyd ac unod i sil o'n nhw'n sôn amdano, pidwch just liquideiso'r pryd cyfan, meddyliwch pa mor ddiflas fydde popeth wedi cymysgu gyda'i gilydd, ond liquideiswch pob darn unigol o'r bwyd ar wahân a'i osod mewn fformat byddech chi'n moyn i weld ar y plat, bod e'n llawer mwy o apelgar i'r person. Ond i'n meddwl bod y darlun na, mae'r darlun na wedi aros dy fi fel rhywbeth, os i ni'n mynd i wneud lles bwyd llesol, trialu arddangos mewn ffordd fel mae rhai o'r criw yma wedi wneud gyda'i bwydydd melys hyfryd. Gobeithio bod hynna'n rhyw fath o syniad i chi o beth i ni wedi bod yn gweithio arno yn ystod y flwyddyn. I ni'n wedi bod yn ymwneud â gymaint o wahanol brosiectau, ond mae croeso chi gysylltu dy fi os ydych chi fwy o fanylion am unrhyw elfen o'r gwaith. Diolch o galon i chi.
Thank you, everyone, for that brilliant presentation over the last hour or so. Does anybody have any questions? I think there's some people have interacted in the chat, but please do, ask some more questions if you've got them for the panel. I don't know about everyone else, but some of those shots of the food at the end have made me quite hungry now for an afternoon snack. They looked amazing. I'm just looking through these questions now. Rosie Muring says, really encouraging to hear Denise's presentation. I'd like to know does she find the budget challenging? Often it feels like there is a limitation, and yet Denise seems to be able to be very creative. So it shows how it can be done. Is there anything to think about in terms of budget there? Anyone want to answer? Did you want to answer that, Suzy?
Is Denise still with us? We'll put her back on the spot now.
Yeah, I haven't got her on the...
had to leave. No, I think she's...
Yeah, I can't see her.
Yeah. Good question to ask though, isn't it?
Yeah.
And we are very fortunate in Wales to have many varying and widespread care homes right across the country, some very big, some very small, and a budget would have to be a big consideration for how you manage that. And I hadn't realised actually until Denise had said in this presentation that how difficult it was for them to get food at the beginning of the pandemic, and I hadn't considered that at all. I know I was doing that for myself and my family, but to try to do that for a care home full of many people with many different sort of choices, and oh gosh, that must have been really challenging. So yeah,
absolutely. Susan, I haven't got your whole name on there. Susan Mason, you seem to have you got your hand up. Did you want to ask a question? Do you want to? I don't know if you have to type it into the chat, do you, rather than being able to unmute, or can we unmute Susan to ask a question?
I have just tried to unmute. I'm not sure whether I've been.
They are, yeah. We can hear you.
Sorry, I forgot about the chat. I was just going to say I don't know what happened to Denise, but I am in charge of her budget, and she gets whatever she wants.
Brilliant.
I do pull my hair out sometimes, when I see crews and all things like that. But very good, very good. Yeah. Okay.
Excellent, thank you.
What was it like, Sue, at the beginning of the pandemic with managing the budgets and managing where the food was going to come from? What was that like for you as a proprietor?
Yeah, it was quite a headache, because when you don't use your local cash and carries and places like that, you use Tesco because you're only a small home. You haven't always got the larder facilities to store big tins and big boxes of everything. So I felt that I was sort of going with my cap in my hand saying, oh, please, can we come into your lovely big cash and carry where I can see you've got lots of food? And they were amazing. Yes, come on, girls, in you come. What do you want? We can deliver. And they delivered it for us. They were really marvellous. Of course, they were in the same boat. They had a lot of food and didn't have schools open, didn't have pubs open. So they weren't able to deliver to them, so they looked for a new outlet, I suppose, in care homes. But yeah, and it was things like, I know we bought a load of pasta, why I don't know now, but I think at the time everybody was saying, oh, you're not going to be able to get toilet rolls, you're not going to be able to get pasta, and I thought, oh my god, a care home without toilet rolls, that would have been not worth thinking about. But the pasta, I've still got loads of it if anybody wants pasta anytime. Yeah,
perhaps there's a craft project there, Tegwen.
Oh, yes, of course. Yeah. But I think from a budgetary point of view, it did show that everything went up. Yeah, we did have to increase our budgets to account for that. Yeah. Okay, we can carry on.
Great. No, thank you. That's really helpful. Excellent. Okay. There's no other questions on the chat at the moment. Does anyone want any final words to say before we finish? Go on, Catrin.
Well, I'd just like to thank everybody for coming together. I know that Charles will thank everybody, but this meeting was genuinely inspired by the idea of if we can come together to support each other. And I think we've heard, you know, through the various speakers, how working across teams or moving into the community to work with different shops or suppliers, it all makes a difference to ensuring that people have the very best experience. And I think we all genuinely want to do our very best. And the hope after today is that we can maybe keep on helping each other beyond lockdown and all the things that we've experienced, learn the best bits, and also keep this community of supporting each other. And I'd just like to, you know, again, I think Suzy is a sort of an inspiring lady to do that. And I'm really pleased that everybody on the panel here has agreed so readily to contribute their sort of expertise. But it's essentially, I know the chat is a bit quiet, but it is really up to you, the people that we can't see now. You know, we can host a webinar and that's it, but I would really love it to be have more of a bit more legs, really. But I don't know if that's a bit too ambitious. What do you think?
That's a good question to throw back out to everyone, isn't it? So it's exactly that, isn't it? So what happens next? You've all come together from slightly different backgrounds, but all with a shared interest in making things better. And it's worked quite well because of an international pandemic that's changed things. But how do we carry on with and it's the same in lots of walks of life, lots of stuff we're doing with older people, just how communities have come together from lots of different backgrounds. But how do we maintain these really good bits now as the world, I'm not going to say returns to a new normal, but, you know, changes again? You know, how do we make sure we carry on with these things and don't get overwrought with normality and go back to what we did before? Anybody got any suggestions? I mean, it's really great that, and Catrin's great at doing this, but it's really great that, you know, academia can work with you guys out in different types of, you know, whether we're working with charities, third sector policy and practice, because we don't want our research sat on dusty shelves. We want to make it happen. So, you know, any tips for help? You know, how do we carry on these kind of partnerships moving forwards, I suppose?
I think, Charles, as well, one of the things, I think Denise is having difficulty connecting back in, but one of the things that Denise had said when I was sort of encouraging her gently to join this today was there doesn't seem to be, that we know of anyway, somewhere where care home cooks and catering staff can go to share best practice or to share their signature dishes, what's working well. And I know in the comments, I think Diana wrote that.
I'm back. Oh, sorry, I'm back. Yes, I'm back in the kitchen. I've had to bring the computer with me. Sorry. I've just managed to come back in, but I'm not good with computers. I'm obviously better in the kitchen.
You can stick to the food, that's fine.
Yeah, sorry.
We're just saying, Denise, that when we were chatting before this, you didn't seem to know, and we're sort of just asking other people really, if there's anywhere that care home cooks or catering staff can go to hear about what other care homes are doing, or to share your signature dishes. Is there anything like that?
A Facebook page would be brilliant for that. You know, anybody can set up a Facebook page, and if it's a closed group, because even Ciro'r Corona and Coginio is a closed group. Yes, I have physically, with 2 members of staff, left 16,900 members in to monitor who actually joins the group. However, I think it's such a safe place to do so, and you can share tips, you can share good practice, and you can do that safely. And experts can also add to that page if they wish to do so. We've had some professional chefs actually putting things up because they want to help the general public. So it's quite a nice way and a safe way of doing it if you like technology. But even for the people who don't like technology, there are means and forms of learning to do basic, just watching what's going on the Facebook page.
Right.
That's a great simple idea, isn't it, as well, and a good starting point to just get people involved and sharing best practice and things. And I like the idea of the awards as well. It's a great idea. You know, how do we, yeah, you know, it's about focusing that effort, isn't it, and then carrying it on. Sharing best practice, sharing what works well, and hints and tips as well, and stuff like that. It's really good. Yeah, excellent.
Yeah, I think, sorry, just to add to that, if anyone, like I said, I've left my contact details, if anyone does think of anything, because it's so important to get the feedback from people working in care homes, the residents, the staff, the chefs and so on, because they're the ones doing the work day to day, aren't they? We come in and out of care homes, we're not based there permanently. So although we've got a good understanding, we're not there all the time. So any feedback would be fantastic, because we will definitely use it moving forward. Thank you.
Excellent. Any last points from anyone?
I don't know if Denise is doing a live demonstration for us. We have to pay extra for that. Thank you.
Brilliant. Well, thank you very much, everyone. Thank you all for your time and contributing to this seminar. It's been excellent, and just shows again, how interesting you can keep this seminar, these seminars when you come from slightly different angles when looking at the same kind of thing. I just thought it was excellent. There's so much more that can be done when you work in partnership together on these kind of things. So thank you for coming together to do that, and thank you for coming together to the seminar to do that, to put on today for us. Much appreciated, and hopefully we can carry on working with you all moving forward. So that would be really great if we can do that. So thank you very much for your time. I think was there one more comment in the chat before we go? But yeah, as Catrin says at the end there, look, just get in touch if people want to connect today. Contact Catrin, contact us through CADA if you want to stay linked together in all of the stuff that we do, including the presentations today, and we'll take this forwards and hopefully work with more people again on this moving forward. So that's really great. So thank you everyone for your time. Thank you to Larry for the simultaneous translation as well, which I always think is an amazing job to do. I don't know how you do it. And it just leaves me to say, so thanks for everybody for listening and taking part, and please do come along to our CADA seminars in the future. We've got one coming up in July, I think it's 21st of July, International Perspective on Safe Visiting for Care Home Residents during the COVID-19 pandemic. So again, a really important topic that we've looked at from lots of different angles, including academia, and trying to bring that across. That'll be via Zoom again. So get in contact on our website, cada.cymru, and sign yourselves up to that if you want to come along. And do please fill in the evaluation forms. It helps us to report back to Healthcare Research Wales what we're doing and who's come along to the seminars, but also help us improve things and share our own best practice for the future. So thank you very much everybody for your time, and thank you for presentations again. Thank you for Catrin for coordinating that, and Suzy for putting that together. But thanks to Marie, Adriana and Tegwin and Denise from the kitchen herself. Brilliant. Thank you very much everyone, and all the best.